डॉक्टर अंशुमान जी, आपने आपका टाइम निकल के अपने क्लिनिक शेयर करने के लिए दिया. दिस इज बेसिकली इज ए फैमिली.
Yes.
Our team is a family, is majority the healthcare people. Here everybody they are into healthcare product. तो ये जो पर्पस है यहाँ पे मेन पर्पस है कि हम लोग आईबीपी मीटिंग में हम लोग मिलते हैं. वहाँ पे क्या होता है, सब लोग अपना अपना इंट्रोडक्शन देते हैं. अभी हम लोग काउंटर का कॉन्सेप्ट लेके आया. दिस इज वेरी वेरी गुड कॉन्सेप्ट, क्योंकि किधर भी जाते हो तो काउंटर के लिए पैसा लगता है, बट आईबीपी में फ्री. आईबीपी का सबसे बड़ा बिग प्लस पॉइंट इज आईबीपी एवरीथिंग इज लाइफ. कल मेरे को किसी ने पूछ रहा था, आप ही पूछ रहा था कौन क्या बोला था, कुछ तो मैं भूल गया. वही बोल रहा था, मैं बोला भाई एक बार जाओ आईबीपी न्यूज चैनल में जाओ, गो टू द रेफरल शेयरिंग. आपको देख मेरे को भी पूछते हो, इसलिए तो बनाया गया इसको. अगर डॉक्टर अंशुमान सर किसी को रेफरेंस दिया एग्जाम्पल और काश्मीरा जी भूल गई उसको, तो ऑटोमेटिक उसमें से आ जाएगा. रेफरल में पूरा एवरीथिंग अनकट है, पूरा एवरीथिंग इज अनकट. यहाँ पे कोई कट पेस्ट नहीं, अनकट ही. वैसे सतीश डायरेक्शन में शूटिंग करते हैं जहाँ पे अनकट ही होता है सब कुछ. ठीक है ना. अभी पावर टीम मीटिंग का कॉन्सेप्ट क्या है, दिस इज द वेरी वेरी इंपॉर्टेंट पावर टीम मीटिंग, जहाँ पे 2-3 टाइप का पावर टीम मीटिंग होगा. एक मीटिंग हो रहा है मेडिकल होगा, इट इज हेल्थ एंड वेलनेस, जहाँ पे एवरीबॉडी इनटू द सिमिलर फील्ड बट नॉट ए कॉम्पिटिटर फॉर ईच अदर. कॉम्पिटिटर होगा तो नहीं हो सकता. ठीक है ना. तो दिस इज मतलब यहाँ पे कोई किसी का कॉम्पिटिटर नहीं, बट एवरीबॉडी कैन हेल्प ईच अदर. नेटवर्किंग ग्रुप का कॉन्सेप्ट ही हेल्पिंग ईच अदर. अगर हेल्प नहीं करेगा तो नेटवर्किंग का कॉन्सेप्ट ही यूजलेस है. ठीक है ना. तो अभी हमारा जो फर्स्ट पार्ट है, इसमें फर्स्ट पार्ट में हम लोग सॉफ्ट बारी में एवरीबॉडी 2-2 मिनट लेके अपना बारे में थोड़ा डिटेल में बोलो. मतलब ऐसे बोलो जो सामने वाला जो वीडियो देखेगा हमारा, जाके हमारा आईबीपी मेंबर्स लोग, ये लोग को पता चलेगा हम क्या करते हैं. ठीक है ना. सुनिए बोलो कि मेडिक्लेम को, मेडिक्लेम के ऊपर जितना है सब कुछ बोलो. डोमेस्टिक मेडिक्लेम, ओवरसीज मेडिक्लेम दोनों लेके बोलो. ठीक है ना. कश्मीर जी अपना पैथोलॉजी को बोलो, आप ओनली हेल्थ केयर प्रोडक्ट को बोलो, हेल्थ केयर, ब्यूटी, डाइटिंग, फिजियोथेरेपी. इसके बाद नेक्स्ट स्टेप में हम लोग देखेंगे टाई अप कैसे होगा, किसके साथ किसका टाई अप होगा. लेकिन ये रिकॉर्डेड है, अकॉर्डिंगली एक्ट करना पड़ेगा. इधर बोल के जाएंगे हम ये करेंगे, बाद में जाके कुछ नहीं करेगा तो मीटिंग विल बी यूजलेस. ठीक है ना. तो अंशुमान सर इज द होस्ट. तो अंशुमान सर पहले,
I will speak in the last.
अच्छा लास्ट में. So let's start with
the.
Everyone, good afternoon. It's good to be here this afternoon. Thank you to Dr. Anshuman organizing this, and Shubhata ji, who is the main person in IBP. He is always behind every one of us. So basically for my introduction, hi, I am Dr. Nikhil Shah. I am a physiotherapist by profession. I've been practicing since almost 15 years now. I specialize in spine and knees, and I also specialize in customizing foot insoles, in which your entire foot mapping is done, and accordingly we customize your insoles with the correction. And I specialize in geriatric care also, so old age patients. I do a lot of group therapy classes. So whenever there is large, say 5 people, 10 people, 15 people, I tend to do group sessions as well. And that's it. My niche is into musculoskeletal and manual therapy. So I also practice manual therapy and exercise therapy in whole. And anybody with any aches or pains or just want to stay fit, any sports injuries, any kind of flat feet cases, back pain, knee pain, cervical problems, you can get in touch with me. Thank you.
Hello everyone, good afternoon. So thank you Shubhata ji for creating this team. Actually this is what I wanted, actually a power team of health medical people. So for me to start with is I'm Dr. Pooja Shah. I'm consulting homeopath and a dietitian, and I'm practicing since 13-14 years. And I have my own setup clinic in Villaparle West near the station. So we basically lead with lifestyle management of the patient, not only diet. So basically stress factor, the exercise, the sleep pattern, the thirst intake, everything we take care of it, of the patient. And we have inch loss sessions also. So basically we have machines. We have 4 machines in our center where we do U-lipose, we have a tummy tucker massager and all, where basically it doesn't show the result in weight per se, but it helps in body toning and shaping of the body, which ideally this generation needs that. So basically there are various sessions for that, and we target to a particular area where the fat cells are more, and we give a guaranteed result. That is our forte. So how, depending on how much kg patient wants to lose, so till then the patient is with me until and unless he is happy, and then I am also happy in that. So yeah, and homeopathy also we prescribe the medicines of all the cases. Like I specialize actually in pediatric homeopathic, like the kids for the immunity, nutrition and all, and migraine cases. So that is my forte for homeopathy. That's it. Thank you so much.
Hi everyone, thank you Shubhatoji and thank you Anshuman, Dr. Anshuman to give us this place and to be a lovely host. Now let me talk about myself. I am Dr. Malahat. I am basically a homeopath, but of late I have just started off with manufacturing of organic skin and hair products. So I make skin products like creams for everything, like hydrating creams, you have pigmentation creams, anti-marks creams, etc. etc. I also make hair products for hair fall, hair, it's like a hair booster, hair rejuvenator, for dandruff, for itching. I have a clinic in Bandra and in Lokanwala, and as I told you, I have a manufacturing unit, so I have a lab next door wherein everything gets tested and then it comes to my clinic. Now my USP is that all my ingredients are vegetarian and they all come from, they are imported. I mean, they come in containers from abroad. So that's why, a lot of people ask me that how come your creams and your products are working so well. That's because, the things are all from abroad. So it's something different. Nobody, I don't think in India has something what I have. So I'd like to, I would like to just say this, that my ask would be that, anybody who wants to, get their skin and hair corrected and can come to me. And of course, as far as homeopathy is concerned, I also treat diseases like thyroid, PCOD, cancer, blood pressure, and a lot more, So thank you so much.
Myself, Kamal Shinde. I am health consultant. Company's name is Dhanvantari Distributors. I am in Ayurveda medicines. Our medicines, यानी हमारे सभी मेडिसिन है रिसर्च बेस्ड आयुर्वेदिक प्रोप्राइटरी मेडिसिन, और मैं डिस्ट्रीब्यूटर उसका यानी मेडिसिन की डिस्ट्रीब्यूटरशिप मैंने ली है. हमारे आयुर्वेद के सारे मेडिसिन रिसर्च किए हुए हैं, जैसे कि ये कहीं आपको किसी मेडिकल स्टोर में नहीं मिलेंगे, क्योंकि सभी मेडिसिन ये भारत के जाने माने वैज्ञानिकों ने इसको रिसर्च किए, और अलग अलग बीमारियों के लिए, जैसे कि थायराइड है, डायबिटीज है, बीपी है, फिर आपके हार्ट के डिसीज है, किडनी के डिसीज है, या तो अपने घुटनों के कोई डिसीज है, कोई भी आपके ब्रेन रिलेटेड है, ऐसी कोई बीमारी नहीं कि जिसके लिए हमारे पास कोई मेडिसिन नहीं है. सभी प्रकार की बीमारियों को दूर करने की क्षमता इन सारी मेडिसिन में है, क्योंकि ये प्योर आयुर्वेदिक है. इसमें किसी भी प्रकार की केमिकल्स इसमें नहीं है, और इसलिए हम बोलते हैं कि पेशेंट को 99% रिजल्ट आपको मिलेगा. मेरी एक सक्सेस स्टोरी आपको बताऊंगी कि 35 इयर्स ओल्ड पेशेंट हमारे पास पैरालाइज्ड आया हुआ था, और वो 4 to 5 मंथ्स उसने बाहर बहुत कुछ दवाइयाँ ली. फिर उसके बाद वो मेरे रिलेटिव्स ही निकले, तो उनको मैंने कहा कि आप ये सारी मेडिसिन आप जरूर लेना चाहिए, और उन्होंने लिया. विद इन 5 मंथ्स वो अभी विरार से लेके यहाँ विले पार्ले तक वो लेक्चरर है MM कॉलेज में यहाँ पे, और वो बाय ट्रेन सफर कर रहे हैं और फिर वापस जा रहे हैं. ये हमारी मेडिसिन की ये इतनी सारी ताकत है. मेरे पास है उनका यस जरूर. यानी इतना हम बोलते हैं कि डायबिटीज भी आपका रिवर्स हो सकता है, और घुटनों के किसी भी प्रकार के ऑपरेशन करने की, हार्ट का भी ऑपरेशन करने की नौबत नहीं लाते हैं. वैसे ही आपका हार्ट भी मजबूत करते हैं. उसके लिए भी मेरे पास एक ऐसी लेडी है कि जिसके हार्ट में होल है, और वो चल नहीं सकती थी, सीढ़ियाँ नहीं चढ़ सकती थी, लेकिन अभी वो जॉब पे जाती है और अच्छे से वो सफर कर रही है। ये इतनी हमारी मेडिसिन में इतनी ताकत।
मेडिसिन सर्टिफाइड है ISO
यस यस सभी ये
Certified.
हाँ WHO से सर्टिफाइड है सभी।
Very good.
और वैसे ही सभी प्रकार के मेडिसिन से मैं बाद में फिर इसके बारे में वैसे बता सकती हूँ, हाँ बाद में दिखा सकती हूँ। थैंक यू सो मच सुब्रतो जी, आपने मुझे यहाँ पे इनवाइट किया और आप सबसे थैंक यू सो मच।
Good afternoon, everyone. First, many thanks to our host, Dr. Anshuman ji, and a backbone of our IBP leader, Subrato. His constant efforts, really, I can say that who made me come here today. And I'm so grateful that I'm a part of this wonderful power team. By profession, I am a microbiologist, and I have a diagnostic center since past 25 years at a Borivali. अभी हमने कांस्टेंट निखिल जी से, पूजा से स्किन एंड हेयर स्पेशलिस्ट और आयुर्वेदिक सब बीमारी के बारे में सुना, बट हाउ टू गेट फाइंड आउट ये बीमारी है। और एनी काइंड ऑफ बीमारी जस्ट आप ब्लड टेस्ट से पता करो या एक्सरे से पता करो या ECG से फॉर हार्ट और एनी सोनोग्राफी फॉर द स्टोन है या नहीं है। बेसिकली इट्स लाइक अ पॉलीक्लिनिक एंड अ डायग्नोस्टिक अंडर वन रूफ विच वी आर एटलीस्ट जो है पता है, पर थोड़ा ब्लैक एंड व्हाइट देके patient can believe more better way and you can start your journey and giving your specialization into it more effectively. My success story is like I have handled many various health checkups and camps, 50 people to 500 people in a daytime at a various corporate and senior citizen, children and corporate company. Immediately tomorrow I have a 400 people camp at a Borivali East Tinmoti, that is for the Jain community. Again, I was not really very open, but it comes to like as our own Jain community, so I cannot say no. And tomorrow morning by 7 AM, I have to be there with my team. So we keep on giving back to the society, and we keep on doing the multiple awareness program, and we are more specialized into the preventive measures. So anytime, anywhere, whoever wish to conduct for the preventive checkups for the employment or the annual checkups for their team or for their own esteemed patient, I am always there for you all.
So you can mention here this thing, from how to area, from where you can cover.
Usually prior notice होता है तो I try to cover other area, but Western line Virar to Vile Parla to Banda tak.
You have home visits, no?
We do have a home visit.
Yeah,
Parla
yeah,
is my regular. मतलब आज मॉर्निंग में भी होम सर्विस थी विले पार्ले। सो विले पार्ले
सेकंड स्टेप हम डिस्कस करेंगे, सेकंड स्टेप में उसके भी टाई अप की बात
yeah, it's just about me basically, and we can see. So we have every sonography, 2D echo, X-ray, ECG, everything.
ECG you can do the home visit, no? ECG.
Yes, we can do.
Portable X-ray.
Portable X-rays also. Portable ECG.
तो आपको पूजा,
Health checkups.
मालाहाट,
सबके जहाँ जहाँ ह्यूमन है वहाँ वहाँ ब्लड है।
ना ना
आप खून दो हम रिपोर्ट देंगे। आप खून दो हम रिपोर्ट देंगे।
So now Sonia.
Hi, I'm Sonia Punjabi, insurance professional, and I'm really thankful to Subrata sir and Anshuman, Dr. Anshuman, for having this arrangement here. And like into insurance, my forte is health insurance, and we are here to discuss about health and all the benefits. So like we have insurance plans for all ages, right from 0 to like any age, 80 years to 85 years. We have health insurance even for them, and we have even like ailments of all like kind of ailments are covered. Even people who have got cardiac issues, those who have had cancer, Parkinson's, we have even health insurance for them, along with the normal individual and total plans. So this is like a very unique thing, because some companies do not insure such people also, cardiac, bypass who है तो नहीं देते. But here in Startup we have plans for all cardiac patients, and after 30 days they are covered. The cover starts after 30 days itself, so it's not a long wait. And also we have a special thing like for autistic children, for children who have got some health issues like cerebral palsy. For those kind of children also we have cover. So it is like, and even for diabetes, we have a diabetic plan, and like somebody who has already got an insulin, who is on insulin also can take this plan. So it is really very accommodating, and right from 0 to any age we have plans for health insurance. And recently I got a reference from a friend for a Parkinson's patient, and that person was not getting anywhere, the health insurance, and they contacted me, and immediately the process started and all, and then within few days they got the insurance as well. So like Parkinson's is such a thing that people don't want to cover the person, but in Star Health we do have plans for every ailment kind of. So it's really good, and I also do a health checkup. I arrange health camps and all, so I'm really a good tie-up with ma'am. And I've done in many residential buildings and also in Kharjankhana and NL College. So I'm into all these kind of.
You take responsibility for the full team because you are into this team.
Yeah.
अंशुमन सर को भी बुलाओ, अंशुमन सर से
So
कोई जो चीज़ है,
we can have our
पूरा टीम का भी इसको
collaboration
करना पड़ेगा.
that way,
ये
yeah.
क्योंकि उनका नमस्ते हेल्थ को प्रमोट करना जरूरी है.
हाँ.
ठीक है ना, बाकी तो उनका तो वेरी स्पेसिफिक है,
Right.
टाई अप में होगा, बट
So we
नमस्ते
can have talks, like on his the Namaste Health.
नमस्ते हेल्थ
We
चलेगा
can
ना सर.
collaborate on that
You
actually.
try to get do some खर्चिंग करने में परमिशन नहीं मिलता है nowadays.
So easily नहीं मिलते अभी, but I will
Try
try
करो, try करो.
definitely. Yeah.
पूरा टीम के लिए हेल्थ के टीम
Yeah,
का खर्चिंग
yeah.
करना वेरी
What
कॉस्ट.
about lipoma?
What's that?
Non-surgical, I don't know, the daycare, this thing, there is no risk, right?
Daycare also is covered.
Daycare is
Yeah,
covered?
yeah. Okay. All daycare procedures are covered.
Non-surgical is covered or not? What that is what.
No, I was asking for daycare
Do
only.
you have any
Because
plans with physiotherapy also?
Yeah, we have plans in which physiotherapy is also covered.
Atma Namaste everyone. And Atma Namaste is just a small saying. It's not saying a namaste, it is just that I salute the divinity in you. Each of us humans are part of God. Follow any religion, this is what they say. So when I say I salute the divinity in you, I only salute the goodness in you, basically. I do not see what your extra things are. Just the goodness in you. And every human at whatever concept or whatever level has goodness in them. That's natural inborn. But with our lifestyle, with our karmas, we have to evolve. So we get to do bad and good, both. And how we use our free will, that helps us further to make our karmas. And yes, you've done something bad, like you sow an apple seed, you won't get mangoes, you get apples. So similarly, if we do bad, the return may not be this life, but some other life that would come back to us. My role here as a pranic healer is I do healing, I heal energy.
Tell something about the pranic healing. What is
Okay.
pranic healing? Then they can understand.
Pranic healing is a no-touch, no-drug therapy. When we get people to come ask us for healing, we tell them you have to go to the doctor. If there is something critical, visit a doctor, get yourself tested, get all the reports. You can share them with us, but you need to go to a doctor first. We are not medical professionals, we are healers, because that's how the country norms are. So vis-a-vis we can't overtake and say no, don't go to the doctor, I'm healing you, you're going to be perfect. No, that's wrong. Pranic healing is all about energy. Now if you like to know about energy, I can show you what energy is and what energy feels. Would you like to know about energy?
Yeah.
So everyone inhale, when you inhale, your stomach should come out. It's just like a balloon. When you blow air into a balloon, the stomach comes out, and when you exit, it should go in. So everyone close your eyes, feel nice, feel happy, put on a beautiful smile. You got to smile because there you connect to yourself. So naturally we are all beautiful. So let's smile and let's do is inhale, hold your hand, hold the breath, exhale. Feel good about it. Inhale. Hold your breath, exhale. Hold your breath, inhale. Hold, smile at yourself and exhale. And smile once more. Inhale now again, exhale. So this is about flowing your
blood into all your nerves, veins, arteries, wherever, to feel fresh and good. Now we get to know our energy. So what do we do is, hi ladies there. Yeah. So let's do is we inhale, we take our hands apart. When we exhale, we push. So now you can inhale, hold, exhale, push. 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 Now how many felt something between your hands? If any of you feel something in your hands? What?
Some kind of force.
Okay. Did any of you feel?
Some vibrations. I felt that I'm compressing something.
Compressing, yeah, because that is your energy. That is the energy and that is our aura strength. So when you inhale and exhale, your aura also tends to expand. When your aura expands, all your, the best of medical professionals will have all the x-rays. You know it best. You can get MRI, CT scan, but can you find out where the heart is? You can. You can find out an organ, but have you been able to locate a mind? We all talk about mind, mental wellness, illness, but have you located a mind ever? मिला है आपको mind? Yeah, simple सी चीजें, like in India we say prana. कोई मर गया तो हम बोलते उनके प्राण निकल गए. तो आपने उस प्राण को भी कहीं देखा है? एक्सरे वगैरह में नहीं मिला है? नहीं. Because that is the life force energy which is running within us. Like we have the visible physical body. Just to the contour, the shape of our body, there is an energy body which is also called the etheric body, which is also called the energy body. It's a double of our body. So when we have any ailment, the ailment comes and settles in the energy body, and then it takes time to enter the physical body, to get physicalized. So if it is there in your aura, you can shake it off. But when you do inhale, exhale, this energy, this aura expands. Similarly, beyond etheric body, we have the emotional body or the astral body. I'm sure most of you must have heard astral travel. You did astral travel. So that's where we all go to sleep and then we start dreaming. The dreams are usually in the astral level of the planet, in the inner world. So that's where we are. And in that world, there are again layers, sub-layers. In one of those things, there is hell, there is heaven, all on the astral plane.
What exactly you are doing?
So, I'm Dr. Priyanka. I myself am a pediatric dentist. I have a dental clinic in Kandivali West. So there we have an in-house orthodontic. So basically we help you in getting your smile when your teeth are crooked or not aligned. So it's not only just the looks, it's also about the function. Sometimes crooked teeth is not only about कि दिखने में अच्छा नहीं लग रहा है. A lot of time the function hampers. If the teeth are not closing properly, you can later on, maybe not immediately, people have PMJ problems which are associated with your bite. Sometimes teeth are not decayed but you still have pain. That's because your teeth are hitting on each other and then it's called traumatic bite. That also leads, So all these things can be corrected with braces or aligners, or if people don't want to go for that because it takes time. So there is, we can give you caps on your teeth. So basically all those things. Apart from that, like routine treatments like fillings, root canals or implants to replace your missing teeth, bridges, crowns. So those things are there, but our forte is basically kids and aligners and braces. I have a clinic which is kids friendly. We've made it colorful.
I have visited you.
We have a play area upstairs where where if the patients have to wait, they can go up and play. So that is one thing where kids always love to come कि हमको ऊपर खेलने मिलेगा. And in between also we give them breaks and all those things. So anything related to dental can be done over there.
Ortho is there, na, your voice.
Ortho is one major part. of the clinic. The big part, ortho and kids.
Husband is orthodontist.
Yes,
Orthodontist.
yes,
Your
orthodontist.
MBS.
Huh.
And you are
I'm a pediatric dentist. So both of us are MDs. I've done into kids and he's done into braces and aligners now recently, because people don't want braces are visible. People want a treatment out where, you know, I can get my teeth straightened as well, but nobody is able to see what I'm undergoing.
invisible braces.
Yes, so those are invisible ones. So braces are like, once it's on your teeth, you cannot remove them. They will be there for one and a half year, 2 years, whatever your treatment span is. Aligners is a removable thing which you have to wear for 22 hours, and it's there on your teeth, but it slowly moves your teeth. Treatment span is reduced to half, and also it's not visible. So brushing, cleaning, everything becomes easier, and no food restrictions, because your food is not going to get stuck anywhere. There are no braces. So that is where, you know, now even kids, we can do this treatment for kids right from 7 years of age, where they can also have aligners. We have a few kids whom we are treating because that's the age. So basically what people think is ki when they grow up, when all permanent teeth erupt, only you have to go and get your teeth straightened, which is a very wrong and old concept. When you are around 7 or 8 years old, when the kid is, that is when you have to get your first consult, because the growth is still happening. There are many things which can be done when the growth is still happening, and jo that crooked aate hai, we can, you know, get them more straighter, and if they are more straighter, automatically the treatment span reduces. Whatever the, you know, later on extractions can be avoided if you come at an early age, because the jaw growth is still not complete. We can help.
Basically, they will grow in a scaffold which is much more aligned.
Yes, because if we see that the jaw growth is insufficient, we can, at that time when the growth is not complete, you know, we can give things to help the jaw grow, so it can accommodate the teeth properly. So those things can be done at an earlier age. Later, it becomes difficult to do all those things.
रेफरल कोच अपने पोजीशन के रिस्पेक्ट होते हैं.
Okay, so thank you everybody for coming. I mean, I'm very happy with you all coming over here. So first, I will tell you about plastic surgery and then about Namaste Health. So all of you can help me. I will tell you, I take this liberty since it's my clinic to show you what we do. So if you see on the right side, there is elephant foot and elephant hand and all that. So you will be very happy to learn that I am the only person in Mumbai, only surgeon in Mumbai who is treating lymphedema regularly and with the latest surgeries, which hardly less than 100, 200 people in the whole world are doing. Okay. So this is something which is very dear to my heart, and there is no cure otherwise. Okay, only massage and all that. So by surgeries we are able to reduce as less as that. These are the real pictures. We have operated more than 100 patients so far, and by God's grace all of them have improved. One or two have improved less, or one or two have recurred back, but more than 70-80% have improved. And all of you may be coming across in general public people who are helpless, who don't have anything. So right now I am getting patients from Bangalore, Chennai, and all these places coming for this treatment. So this is something which I would request all of you to be mindful and remember this, that yes, there is a center which exists over here. The second thing is, what is plastic surgery? Plastic surgery is, you don't know where to go to a plastic surgeon. Okay? Because we deal from top to bottom. Right? And we have various branches. Cosmetic surgery is just one of it, where a lot of things can be made, hair transplant, say laser, to make you thin with a liposuction. Not grossly thin, but if you have fat elsewhere, or mummies who are there after the pregnancy, I mean they're hanging and all that. So those skin can be, sagging skin can be treated. And liposuction, one important thing is that it is permanent procedure. The fat doesn't come back because we remove the fat cells. Fat will not come back from the place where I have removed the fat. Then we have other things, I mean, facelift, nose job and all that. So liposuction can be done everywhere. This is about cosmetic surgery, but reconstructive surgery भी बहुत होते हैं, which is people don't know. Suppose you get cut. Now, our stitch and a general surgeon stitch will be way different. Okay. So if somebody has got a hand injury, how to make it functional? Okay. So even facial injuries. Now maxillofacial surgeons have also come into this thing, but jaw fixation and all that also done by plastic surgeons. So cancer reconstruction after the cancer reconstruction, burns हो गया, burns तो everybody knows. बच्चे हैं जिनके congenital abnormalities हैं, cleft lip है, palate है, hands नहीं developed है, all that. So we take up all those challenges and we try and reconstruct. So just keep it in mind and try and help us with that. So I've been practicing for the last 25 years. My clinic was in Bandra, but I have shifted over here because traveling was becoming too difficult. So we have treated, thousands of patients over these, and with pretty good results. Okay. Now coming to platform which is Namaste Health, where I would, with my folded hands, I would request you all for a support, because this is one of the first of its kind platform. There are a lot of health applications which are there, like Bajaj said, there are Practo, there are Fine, there are a lot of things. But nobody will connect you to a doctor instantly if you have a problem. Okay. If you have an emergency, which doctor to go, which hospital to go, whether that hospital, where the hospital is the hospital good enough? Will you find a doctor over there? Okay, if you want
surgical treatments also, is it available or not?
Correct. So what facility is there? There are a lot of confusion.
Emergency.
So and what is emergency? Emergency can be severe emergencies like heart attack, stroke. There the window to give a CPR is only 2 to 3 minutes. Right? If you don't give, patient dies. If you make more than 3 minutes, patient will be paralyzed. Okay. If somebody is bleeding, then you have a window of 3-4 minutes to control the bleeding heavily. So an expert advice always comes handy. There are a lot of problems in emergency. Even if you know, you panic and you forget what to do. So this is a platform in which we are connecting you instantly to nearby specialized hospitals based on your problem with their emergency department. The emergency doctor of that particular hospital will pick up, and the minimum criteria for that kind of hospital is that it should have a OT and ICU and multiple specialists over there. In addition, we will be connecting to the doctors and all that. So this is a startup. I am looking for, and situational emergencies are there, right? Middle of the night, even if there is a 2-3 vomitings, it's an emergency.
Absolutely.
Okay. Although it
Even a
is
griping stomachache.
correct, typing or any small problem which gets aggravated, or if you are alone sometime, nobody to help you, or elderly patients, or children. So there are a lot of things which are a semi-emergency, but they become situationally bigger, magnified emergency. So at that time, you get an instant access to the nearby hospitals. You get a choice, and then you also get kind of how to go to the hospital, and in critical emergencies will
It's like a ready veterinary.
absolutely. So I just should take this. This is the app.
I'll forward the name of that.
This is called Namaste Health.
I forwarded it already to all.
Requesting everyone, please download the app.
I will just show you.
Go to the Google Play Store and download that. We already done.
So if
You get connected to the
Yeah.
doctor, or
Yeah.
the ambulance comes emergency.
सब लोग कंप्लेंट दर्शन को कनेक्ट करा देते हैं
connected to the hospital. So So you get 3-4 hospitals which are over here. I have just typed breathlessness over here.
अच्छा ये प्राइवेट सेंटर
हाँ तो it's already there.
इससे चार्जेस वगैरह कुछ है
सब मैं बता देता हूँ. And you press on the video icon.
we get connected to the doctor also. It's easy for the doctor also to understand what's happening.
Before going to hospital, the patient can connect with the
Correct.
doctor.
So it starts getting connected to the. He is getting a ring. इसका है ये है. Yes. Yes. So he is there on the call. As simple as
लाइट
that.
देखा दो लाइट
As simple as that.
उधर देख के बोलो.
Okay. So this is the direct call. I have chosen one hospital out of the 5 which was given, which is a testing ID, and the call gets connected. Now in this call, I can add another doctor also. If I want a specialist, I can add a specialist and I can kind of take opinion from a specialist. Second opinion. The doctor can suggest the hospital from his lab, right? And Premal, can you suggest a hospital? Can you suggest me a hospital? Okay, thank you. I'm ending the call.
अपना हेल्थ केयर टीम पूरा
अर्चना
दे दिया. अभी नाउ रत्नाकर सर.
अर्चना प्रिपेयर करना बेटा.
थोड़ा बता दो ना क्या देखो.
नहीं मेरे को आप
You are
लास्ट
the
टाइम
event
में
man
सिर्फ
here.
ले ही रहे थे.
बाबा यू आर द पार्ट ऑफ द आईबीपी रेफरल कोच.
आपका आस
हर जगह पे जाना है.
आस
आज
बता
से
दो.
बताओ पहले.
आस बता दो बस.
सर मुझे लगता है वो आज बोल के हम दे पाएंगे.
हाँ हाँ नहीं दे पाएंगे. आप आस बताओ ना.
आपका जो लोग सोसाइटी.
चलो ठीक है.
सुनोगे तो कोशिश करो.
लोड चाहिए होगा.
ठीक है. I will introduce myself in a very easy language rather. I am basically a civil engineer having more than 38 years of experience in Mumbai. Okay, and we are into basically structural audits of cooperative housing society buildings. You all must be staying in a society, in a flat, in a bungalow, or whatever it is. Okay, so when a building gets older than 30 years, the MCGM, Municipal Corporation of Greater Mumbai, they have a norm that after 30 years age, you have to carry out the structural audit of particular building every 3rd year. That is mandatory and compulsory. Okay, and there I enter. My entry is there. So far, we have completed audit of more than 3,000 building structures in Mumbai. We have saved more than 50 buildings from collapsing. Okay, and already repaired more than 800 buildings in my this
So the repairing part also.
repair part.
Your team has it.
Everything. So this is my ask. If you are staying in a society, you or your parents are taking active part in the society, like they are chairman, treasurer, or secretary. Okay, they may receive notice from municipality, 354B notice. I am the best connect here in Mumbai. I am the only person. There are so many categories in Mumbai. When the category is C1, when the category is C1, that means you have to vacate the building within 4 days or 5 days.
I know that.
And I am the only person who has converted from C1 to C2. From C1 category, the government had already given C1 category, and I got it turned from C1 to C2 by only when we were in the meeting. तो मैंने इतना ही बोला कि एक और एक दो आपको स्कूल में पढ़ाया है, वो आपको बताया है, वही मुझे भी पढ़ाया है. चलो चैलेंज करते दोनों के नॉलेज की, दोनों के नॉलेज के हिसाब से. दैट वे इट वाज डन. इतना भी हिम्मत इसमें नहीं होता है. बेस्ट पर्सन आई एम टेलिंग यू. आई एम नॉट एडवर्टाइजिंग.
सर अभी समझ तो गया ना आपका आस क्या है. तो
अभी रत्नाकर सर का ही इज ए गुड गिवर. बट गिवर को भी तो गेन चाहिए.
अभी द मोमेंट मुझे डॉक्टर साहब मिले थे ना, अभी उस दिन से चक्कर चालू है, दिमाग का चक्कर चालू है. मैंने मेरे 2 दोस्त है बहुत बढ़िया. एक ने अभी 8,000 स्क्वायर फीट का थाना में जगह लिया है, उसका मल्टी स्पेशलिटी हॉस्पिटल बना के. आई एम टॉकिंग अबाउट डॉक्टर्स ओनली. तो उनके साथ में बहुत चर्चा हो रही है। अभी आप जब भी बात कर रहे थे ना, तो अभी मैंने उसमें मैसेजेस भी भेज दिए हैं उनको, और उनकी 1-on-1 में आपसे बात करवा दूंगा। हो सकता है अपने को कुछ आइडियाज मिले और कुछ उनके कनेक्ट है,
क्योंकि कोई कॉर्पोरेट कनेक्ट भी है तो उनका नोट्स है पूरा कनेक्ट करा।
कौन सा चाहिए वो मुझे बैठ के देखना
मैं
पड़ेगा।
ये पर्सनल लेवल में बात
बैठ के देखना पड़ेगा कॉर्पोरेट कौन सा।
नमस्ते हेल्प ही है
खुद ही करो
I said Ratnakar himself is a namaste.
नहीं ऐसा नहीं है, ऐसा नहीं है। मेरा हैबिट देखा है आपने, कभी मीटिंग में बैठा हूँ तो I've paid down everything.
What he is doing is seeing that
I've paid down everything. You are asked solve. आप उस वक्त जो आपका इंट्रोडक्शन देते हो ना, वही मेरे पास में रहेगा। उस टाइम पे बत्ती जलती है कि इनको हम क्या दे सकते हैं।
that mentality is everybody doesn't that. He got that mentality that I will help you. Because of that, I requested him become our reference coach.
Yes.
He said, "No, I am ready. I am okay."
He's a very, very.
He's a nice person. जैसे मैं एग्जांपल दे रहा हूँ, डॉक्टर प्रियंका एंड डॉक्टर अंशुमन ऑलरेडी, डॉक्टर पूजा एंड डॉक्टर अंशुमन ऑलरेडी they had a discussion and they are into collaboration. How now you brief? What kind of collaboration both of you are doing? No shit, only the percentage it is not required. Only the what collaboration you are going to do, then everybody will try to do like this. So then only business will generate.
Yeah, so basically you all know I have a dietitian and he is into liposuctions and various surgeries where he removes the fat cells. So मेरे patients क्या होते हैं, sometimes that we stuck into it कि कितना भी diet दो, कितना भी inch loss करो sessions, it is stuck to a point के patient में नहीं उतर रहा है, मतलब उतरने का भी तो भी वापस बढ़ जाता है। And we suggest that he is a higher step to me कि भाई आप liposuction करवा ही लो, because ultimately for you if a wedding is so much important after 6 months, for you everything is so much important, तो आप मेरे को 6 महीना भी दोगे, 1 साल भी दोगे, मेरा एक लिमिटेशन आ जाएगा कि नॉर्मल डाइट से आप भी नहीं तो बाद में बोर हो जाओगे 6 महीने 1 साल बाद, और कितने सेशंस मैं दूंगी है ना, लाइक यू इफ इट इज एन इमरजेंसी लाइक सो परमानेंट सॉल्यूशन इज गेट liposuction, so I can transfer my patients to him and I have done that, but I think you did like so I had one more the doctor. So वैसे I used to do, but of course now I can
They have a give and take. Even Dr.
and he can refer me his online patients for tummy tuckers. जो patient को actually surgery में नहीं जाना है, non-invasive procedure कि थोड़ा एक टमी का एक ही पार्ट का टारगेट एरिया है कि फैट सेल्स कम करना है, थोड़ा इंच लॉस करना है, so he can refer me. And of course post op I think you require more for diet plans, weight management. Basically, because I have heard that people put on also, so it's vice versa, it's 50-50. In our field it is always like that. So वो manage कर सकती हूँ, basically ground level पे, yeah.
So this is the collaboration because this is our team. How we can collaborate with each other. So now you talk also Kashmira ji, then she is also into the Ayurvedic product.
So another level is not go that depends on because that depends on which side your hospital. Your hospital your size is different. My
To you that is that organization before. She has left to have one meeting.
The last time the lady was there.
So she has said 1 hour so he is unwell. So I told him, but definitely want to collaborate.
अच्छा, I want you do collaboration with them.
Madam के साथ तो definitely.
अच्छा, सर आप ये बताओ.
Everything so that I have to send something to the
Correct.
I should know.
Yes, yes.
एक बार तुम बैठ के सर के साथ बैठ के
तो आपके लिए
One to one
निकल से तो ऑलरेडी मैंने मैडम का
नहीं तो चार
थिंक वेयर हाउ to help, but it is definitely on my agenda.
Yeah, that's fine.
And Priyanka, yes,
individual
there are definitely patients who are there.
चलो थोड़ी देर से भी बात कर लो.
116, 115, 125 kg वाले लोग आए थे.
And let us not forget, sir, Balakrishna, sir. Oh,
अच्छा, now
he has been very, let me tell, he has been very, very
he is my very close friend and always with me.
enthusiastic and very, very patient. That's the word. I mean,
And very helpful
he
person.
wants to help and.
वो तो always in touch with you. अच्छा, पूजा आप बताओ किस किस के साथ आपको टाई अप करना है?
So many years.
हाँ, so we should not forget the man behind the camera.
No, but he's nearly 20 years, not behind the camera, also into
He is a computer
he's
engineer.
a computer
No, over
engineer.
here, over here he is there. So
IBP
we
news
should not.
product. He is from IBP news video. So Pooja, she supposed to leave that before that let her finish her session. You want to tie up
I
with?
think we've spoken.
Then
So today, I already spoken. So this is our agreement.
but
Okay.
आप दोनों जन साथ में बात करो how ratio. This is a collaboration with business ratio. Percentage everything will decide. IBP is no concern on that.
Let's see. Yeah, we will figure out that.
That is your individual decision, not necessary to disclose in IBP. Even you and Dr. Anshuman sir is individual, but IBP should only helping you to collaborate. Next is तो खाना लाके दे रहा हूँ आप अभी आप डिसाइड करो कैसे खाना ठीक है ना.
So I am actually.
Can you do collaborative Sonia also?
So so I would like to.
Because
the
you-
health insurance, I'll have to figure out. We have wellness. We have diabetes plan. So how do I tell my already everyone is having, na?
For that you have to do the one-to-one meeting. Both of you do the one-to-one meeting.
We have bariatric surgery also covered in insurance. But then the person should not be that, kg should not be so much. Later on, after taking the insurance, we have to do a bariatric, then it's covered. Bariatric and to ask.
Liposuction, we just take out the fat. It is actually not a weight loss surgery. Because fat तो कितना मैं 10 लीटर भी निकालूंगा तो 6-7 किलो कम होगा. Fat is always lighter than. Okay. So that is not a weight loss surgery. It is basically it gives you back the shape. And that's the permanent. Okay, because fats don't regenerate. Tummy tuck, we can lose some weight if the tummy is hanging around 7-8 kgs, and a lot of ladies have that. That they can get rid of, and that will improve their back pain, their urine issues, and so many other things, posture and all that. That is bariatric surgery. We make the stomach less. Our stomach is this big. We make the size of the stomach less, so that you are not able to eat. Correct. It is cut into 1/3. So you are not able to eat.
You do have limitations.
You always feel like full. The drawback also is that gradually the stomach again expands. Elastic. And the second problem is that lifelong really it's some medications require and handicap for
So you take
bariatric, I do liposuction, I do tummy tuck. Bariatric, I have a team of people who do it. Okay. But I am not in favor of a bariatric surgery before BMI, less than BMI of 35 or 40. When it is considered as morbid obesity. Morbid obesity is when there is a threat to life. You have to do it. Okay.
keep coming.
Everything you can do collaboration. She got all the independent company. She got all the products. So you are a dietitian. I will give you a I will get a type of a type. No issue. But you can do.
नमस्ते हेल्थ से कर सकते हैं.
नमस्ते से तो आप नमस्ते
नमस्ते हेल्थ के साथ मिलकर
she got scientists also with her. The manufacturer highly qualified and scientists. Next meeting is senior will come also. She will put the store. She also premium. This is one. अभी पूजा को चाहिए सेलिब्रिटी का कनेक्शन रत्नाकर साथ देखो कुछ कर सकते हो. You told me that.
Okay.
Wait, मतलब as a dietitian you want ना, you are I believe you are looking for good connection.
मतलब हवा बदल का नहीं.
Good connection.
किसके लिए चाहिए? ये कैसा होता है ना, ये मतलब वहाँ पे जाएंगे तो पता भी तो मुझे भी तो पता होना चाहिए ना कि मैं क्या प्रेफर कर रहा हूँ वहाँ पे.
Weight loss के लिए कर सकते हैं. Weight loss then any kind of stress related health issue like BP, sugar, cholesterol, everything she is covered.
Cover the diseases as well. मतलब for BP, natural diet.
Basically for diet and insurance.
Diet and insurance.
आप नॉर्मल लोग को भी कर सकते हैं, किसी को भी बोल सकते हैं।
कॉस्मेटिक सर्जरी के लिए आप मेरे को भी
क्या है, आई एम ट्राइंग टू बी वेरी प्रैक्टिकल ना।
आपको एक बार रत्नाकर सर से
प्रैक्टिकल इसलिए कि अगर समझो कोई बड़ा सेलिब्रिटी तो वो मतलब वो
जो वेरी सीनियर डायटिशियन,
बड़े सीनियर डायटिशियन हैं वो, तो उसको किस तरह से कन्वर्ट मुझे करना है, उसके लिए मुझे आपसे बात करनी पड़ेगी ना।
our classmate she is a doctor also.
Huh?
There are a lot of dietitian, they are not a doctor. She is a homeopathy doctor. So that's a
किस तरह से देखो ये कन्वर्ट करना है, इसको है ना जनरेट करना है बिजनेस को। ये सामने से आने वाला बिजनेस नहीं है, इसको तो जनरेट।
सेम थिंग आपको इसको भी
का
चाहिए।
यूएसपी
She is
बताना
also looking for.
नहीं,
इनका यूएसपी उनको आपको ज्यादा बताना पड़ेगा।
यूएसपी तो ठीक है, डर और लालच बिठाना पड़ेगा ना।
She will educate.
डर और लालच बिठाना पड़ेगा, तभी इनका बिजनेस चलेगा।
अच्छा रत्नाकर सर आपको सेम चीज के लिए ये भी
तब मैं डराता नहीं हूँ ना और लालच नहीं देता हूँ। आप आपकी जेब में हाथ डालेंगे ही पैसा निकालने को।
सही बात।
लेट मी बी वेरी प्रैक्टिकल, बराबर है।
और आपका सेम कनेक्ट उपमान सर के लिए भी चाहिए। और माला तो मेरे को बोल के रखा है रत्नाकर सर को बोलने का मेरा पहले से ही बोला
लेट अस मेक, बहुत सारे कनेक्शंस हैं,
आप मीट करो उनसे।
बहुत सारे कनेक्शंस हैं उनके साथ में
अच्छा
पता चलना चाहिए।
ये निखिल भाई हाउ यू कैन हेल्प
इसके साथ
रत्नाकर सर के लिए क्या कर सकते हैं?
आपका क्या है बेसिकली?
आई एम अ फिजियोथेरेपिस्ट।
फिजियोथेरेपी।
जॉइंट पेन है, कमर का दर्द है, या फिर स्पोर्ट्स इंजरीज है, लिगामेंट का प्रॉब्लम है, पोस्ट ऑपरेटिव है, किसी ने घुटना बदला है, हिप बॉल चेंज करा है, स्पाइन का सर्जरी किया, उसके बाद जो उन पे एक्सरसाइज करते हैं ना वो है। फिर मैं ग्रुप ओल्ड एज ग्रुप क्लासेस भी करता हूँ, मतलब 5 people 10 people तो ग्रुप रहेगा ना, जैसे मेरे क्लिनिक में भी है, मेरे क्लिनिक में भी देयर इज स्पेस, सो ऑलमोस्ट 5 जन का ग्रुप तो क्लिनिक पे भी कर सकते हैं।
क्लिनिक का
अंधेरी वेस्ट और एक दूसरा हार्वेस्ट
हार्वेस्ट में का
हाँ लिंकिंग रोड पे तुरंत के ऑप्टिशियन के सामने तो शुगर होता है। ये जो सिटी बैंक था अभी एक्सिस बैंक बन गया सिग्नल पे, बस उससे आगे राइट साइड लिंकिंग रोड पे। और अंधेरी वेस्ट में भी 2 मिनट शॉपर स्टॉप है, उसके आगे है थोड़ा देर सिग्नल पे ही। हाँ, वो अंधेरी वेस्ट में कैसे थोड़ा स्पेस बढ़ाएंगे, दैट स्पेस इट्स एन ओपन एरिया।
हाँ बेटा, इसका नहीं क्या हुआ?
बेसिकली ऑर्थो
नहीं एक ही नंबर
ऑर्थो ना ऑर्थो फिजियो
रस्सी से बाहर लेना।
नहीं मैं